From 1 to 4 years old, children are exploring their world and coming into contact with many new things. So this time of life presents some unique health challenges. For one, their immune systems still lack experience, and your child may frequently catch a cold. Generally, colds are caused by a virus. It's named a cold because in the fall, when the temperature first drops, and the children are still wearing light, more summer clothing, or their bodies haven't built up a layer of fat in the skin, that the cold, their bodies are more vulnerable to the cold, and cold goes kind of deeper into their system, and cold temperatures in general depress immunity. And so this depression of immunity causes an infection to arise, usually in the sinuses or upper respiratory tract. And then, if it's not handled properly, it will descend into the lungs. Now, children are in kapha time of life, so they're especially more prone to upper respiratory infections. And children need to eat lots of kapha foods, but those same kapha foods can provoke an excess of mucus. What are some preventative measures? Dress warmly, especially in the fall. Keep the air moist if you have hot indoor heating. If your child's nose is stuffed, then they'll be forced to breathe through their mouth, which is irritating to the lungs and throat. So make sure there's a humidifier in the room to prevent the infection from descending into the lungs. Keep your kids on a routine, especially getting to bed on time, and reduce their stress. Give them a hot bath where they can inhale some steam. A kapha-reducing diet can help while they have the cold. Make sure the food is easy to digest, and you're giving them hot soups, because that heat is going to improve circulation and flush out the cold. Really, a hot bath is the only way to drive out cold temperature from the body, and that is going to improve immunity. Avoid eating too late at night if your child has thick mucus. Avoid exposing the child to damp, cold temperatures also. Avoid exposing them to cold in general, but also cold damp. If it's hot damp, that's okay. All right. Chyawanprash is a general remedy at the first sign of a cold. And Chyawanprash is just a great formula. You can give it to your child after the age of 2. You can also give them gold milk. That's medicated. That's milk basically with trichotillue and turmeric, or even honey. And that's great, and the children like it. It's very helpful. Kapha-reducing herbs like pipli. Pipli is such a great lung tonic, and you can see the rest of those herbs listed here on the slide. So yeah, colds, children get them. They're very common in years 1 to 4, and even in 5 to 9. Conjunctivitis is pink eye, and that's when the there's actually a transparent layer of skin or a membrane covering your eye, and it's called the conjunctiva. And when that gets infected, typically by a virus, it leads to inflammation. And conjunctivitis means inflammation of the conjunctiva. Sometimes it's not caused by a viral infection, but by an allergic reaction. And that's typical. And if a child is getting conjunctivitis due to allergens, it's a good indicate. That may be the case if the child has other allergens. Now, what happens is during pink eye, there's a lot of discharge from the eye, and the kid will constantly be wiping their eye and then touching other things around the house. And that's going to basically spread the virus all over the house, on clothing, doorknobs, etc. And then someone else will touch the doorknob and then touch their eye, and that will spread the infection. So it's highly contagious. It's easily spread in communal settings like daycare, swimming pool, etc. Kids are touching everything. And their awareness and discipline around hygiene is still really poor. So if you have an infection, wash your hands regularly. Try not to get both eyes infected. Clean your eyes with cotton balls soaked in warm water. And clean from the inner part of the eye to the outer part, not the other way around. You can also put breast milk in a baby's eyes with a cotton ball or just directly, and that won't treat the infection, but will give them some relief. It's a cooling. See a doctor if conjunctivitis doesn't improve, or if there is some pain or vision loss, or increase in swelling and tenderness, or if there's a white spot on the cornea that doesn't go away. Generally, anti-inflammatory herbs. You can make a tea of an anti-inflammatory herb and strain it. Something like even turmeric tea, or a green tea bag, or aloe vera gel around the eye is some good ideas. Tulsi tea eye wash can also be good for conjunctivitis. Hand, foot, and mouth disease is a contagious viral infection that's also common in young children, and it is characterized by sores in the mouth and a rash on the hands and feet. And it's caused by the Coxsackie virus. It's spread through human contact, just like conjunctivitis, a toy, doorknob, etc., and generally clears within 7 to 10 days. So for that one, you're just going to wash hands to avoid spreading and take soothing foods. Popsicle can reduce soreness. Avoiding acidic, salty, or spicy or irritating foods. Instead, favor soft and easy to chew foods so that it's easy for them to eat it while they have sores all over their mouth. And also cooling anti-inflammatories like coconut oil, turmeric, aloe. In general, don't forget about your immune-boosting herbs when you're dealing with childhood illnesses. Ginger, elderberry syrup, garlic, aloe vera, and even the formula in Ayurveda, Mahasudarshan. All right, asthma is another big topic for children from 1 to 4 and even 5 to 9. And asthma is characterized by inflammation and spasm of the bronchial tubes that make it difficult to breathe. Constriction in the bronchial tubes. In the Western pathogenesis, the cause is not really clear, but it's associated with these factors listed on the slide. A tendency to develop allergies or exposure to toxins and pollution, irritating the lungs. Genetic factors, infections, obesity, poor digestion can cause toxins in the blood, which can irritate the lungs and then lead to asthma. Triggers can also include weather changes, viral infections, and even exercise, right? You start breathing heavy, it starts irritating your lungs, and then you get an asthma attack. Or even heartburn, because the acid regurgitates upward in the esophagus and then goes down the windpipe and irritates the lungs. What does Ayurveda say about asthma? Asthma is considered to be eczema of the lungs, just like ulcerative colitis is considered to be eczema of the colon. There are 3 main types of asthma, which is Vata type, which is stress or exercise induced. Pitta is due to allergens or infection or something that inflames the bronchioles, and Kapha type is from mucus buildup in the bronchioles. So think about which type of asthma you might have or your client might have. Ultimately, Kapha is involved in all types of asthma, and that's why in Ayurveda, one of the first lines of treatment for asthma is vomiting treatment to quickly reduce Kapha. In general, also limit your exposure to triggers. Have a dehumidifier if that helps. Reducing dampness sometimes helps for lungs. Do some regular exercise to develop healthy lung function if you don't have exercise-induced asthma. Reduce exposure to cold air. In general, be doing breathing exercises also, like pranayama, to develop lung capacity. For diet treatments, use wholesome, well-digested foods that support a healthy weight and avoid heartburn. So yeah, by well-digested, I mean easy-to-digest foods. So basically a diet that pacifies your dosha and that you can digest and doesn't cause heartburn. You can use digestives to assist with digestion. That's going to reduce ama. I mean, the reason why you want to improve digestion is because it's going to reduce ama, and that's going to make the lungs less irritated, make the immune system less reactive. Anti-inflammatories for pitta type asthma, like boswellia. And antispasmodics can help because the bronchial tubes are spasming. Bronchodilators can help, and bronchodilators are often aromatic herbs. Just think about fennel and cardamom are good bronchodilators. Also ajmoda. And think about expectorants. Cardamom is also an expectorant. Harataki is an expectorant. Harataki is also a good laxative that will clear ama or toxins from the system. Your vasodilators, generally most of your vasodilators are also bronchodilators, so you get 2 for 1 there. And then there's some specific herbs that belong to a class that are anti-asthmatic. And listed here are bala and cloves. We said that asthma was eczema of the lungs. Well, what do we do about eczema? So, and these treatments in general are probably going to be good for asthma as well, by the way. Well, what is eczema? Eczema is a rash, often dry and scaly, but can sometimes be a wet type eczema as well. And it's often caused by food or environmental allergies. It may be genetic as well. But from an Ayurvedic point of view, generally it starts with a liver imbalance or high pitta. There's maybe ama in the blood, toxins in the blood because of the liver imbalance, and that irritates and causes rashes on the skin. Or a second kind is where your body becomes hypersensitive, and then also due to a liver imbalance, and then you become more sensitive to allergens, and the eczema results. So get tested for allergies, figure out things you're allergic to, avoid certain body products or clothing or harsh soaps and detergents that may cause contact dermatitis. Reduce stress, and just remember that cold and dry air can aggravate. So keep warm and get a humidifier. Notice that that's a little different from asthma. Asthma can be aggravated by damp conditions for many, but here eczema, we're saying it's helped by dampness. An elimination diet to try an elimination diet, which basically means you start off with something like khichdi that has a few number of ingredients and then slowly introduce foods, just to see whether it's not a food that's causing the eczema. Since eczema is really about liver imbalance, causing blood level imbalance, causing irritation to the skin, we also have an opportunity for intervention at the level of the blood. So some alternatives are herbs that rebalance blood chemistry and will help get that ama out of the blood. So aloe, bakuchi, and bringaraj are some examples of alternatives. There are many food-based alternatives as well. You can see a list on Joyful Belly of that. But generally, those alternatives are sour, bitter, and yeah, generally some combination of sour and bitter. All right, emollients can help in the case of eczema. You rub it right on the eczema, and that includes castor oil. You can also think about anti-inflammatories like gotu kola and guduchi. Young kids are always at a risk for drowning. I just can't, I just don't want to overlook this when talking about care for young children, especially around 2 years old. It just seems like every one of my kids, when they're 2, have some kind of near drowning experience. My oldest daughter, Carmela, she was swimming at the beach. Wading, really. She was 2 years old. The water was up to her waist. It was at a lake. And I was talking to a friend, and I turn over, and she's face down in the water, flailing about. Apparently, the water was just deep enough where once she fell over, she didn't know how to get back up. and I was about 50 feet away from her, and you never saw a person, move so fast. I was like 2 steps, and I was like at her side and lifted her out of the water, and she gasped for air. And so that was, she very nearly drowned. I looked over at the lifeguard, and the lifeguard was calmly sitting there reading a book. So, drowning is a risk, especially at that 2-year-old age. It seems like Alora, my second daughter, we were at a pool in Myrtle Beach, and she decided she wanted to go swimming. But none of us heard her jump in the water. And so she sank right to the bottom. And then she started, thank goodness she had enough sense to do this. She started jumping off the bottom, and she had enough momentum that she could get a breath of air before sinking back down, and then was jumping up again. Well, because she was jumping up and down, we eventually heard her, and, we were only standing 10 feet away from her, but we just didn't know that she was even in the pool. And then Natalie, my wife, jumped in with her clothes on and rescued her from the water. But thank goodness she didn't just sit on the bottom, because then we would have never heard her or noticed her. Even my daughter was lying on her belly in a bathtub, and there was only 3 inches of water there. She was propped up on her elbows, and then she coughed. And when she coughed, she pushed her head forward, and then while she was submerged, gasped for air after the cough, and started choking. So, just always those scares as a parent keep you awake at night. Sometimes you'll wake up with a cold sweat, like thinking about some, dangerous situation with your kid. So, that's always a possibility. So just be careful with the kiddos on drowning risks.